The vast majority of outer hip pain comes from one group of muscles at the side of your pelvis, and strengthening these muscles can give you a lifetime worth of relief. But it has to be done in a very specific way to cover every important muscle. So today I'm going to show you the 1-minute exercise that fixed years of hip pain for me and has helped hundreds of my patients over the last 30 years, and the big mistake to avoid while doing it. The gluteus medius muscle is notorious for becoming weak, and the resulting muscle knots, tendinitis and bursitis causes most outer hip pain. But for some people, two nearby muscles can contribute to the pain, so two of the exercises that I'm going to show you today strengthen all three muscles. Set up by facing a wall, hands rested against the wall, standing on the leg of your painful hip. For the basic version of this exercise, simply use the muscles in your outer pelvis to slowly tilt your pelvis up on the other side, hold for a few seconds, and then lower again. Make sure that you're using the outer pelvic muscles of the leg that you're standing on to control the whole movement, not your other leg muscles or your back muscles. To cover the other muscles that can contribute to hip pain, start to vary the angle. Firstly, tilt your pelvis directly to the side, then change the angle by about 10 to 20 degrees to lift the other side of your pelvis slightly behind you, and then slightly in front of you. Repeat these three directions until you feel a light fatigue in your outer pelvic muscles. A bit of a burn, but no more. Do that daily until you reach about 10 reps comfortably, and then every second day as you begin to do more. You should aim to reach 20 reps on each side. The most common mistake people make when doing this exercise is flexing forward slightly at the hip. This makes the exercise easier but doesn't work the right muscles. So bring your pelvis forward more in line with your body before tilting up to the side. Over time, as you master this exercise, you can move on to the advanced version. Here, without using the wall, firstly tilt your pelvis up to the side, and then begin to move the opposite hip in a circular type movement, a bit like a slow hula hoop motion. It might help to imagine that you're drawing a circle with your opposite hip. Repeat until light fatigue, no more, and do that daily until you reach 10 reps on each side, and then every second day as you progress to doing more. Now, having this hip issue is really part of a bigger problem. These outer gluteal muscles are often the first muscles to weaken as we age, but as other muscles weaken, you can end up with a whole host of other issues like knee and shoulder pain, instability when walking, trouble with stairs, and getting up out of a chair. This is all avoidable though by maintaining your overall strength over the age of 50, which is crucial to keep your independence as you age. So for a bit of help with that, watch this video next.